Hello, friends. Good evening. Myself, Dr. Priyank Salecha, consultant urologist and andrologist at Apollo Spectra Hospital, Kondapur, Hyderabad, will be speaking something regarding renal stone. In today's talk, the main focus will be why we are suffering from renal stone, how they are formed, and what are the dietary modifications which we should do and follow, and what are the symptoms or the alarming signs when we should stop taking routine medication and go for a surgical procedure. So, first of all, what are renal stones? They are nothing but concretions or calcifications which are seen within the kidney. In a very simple language, they are calculi or stones or calcification which are present within renal parenchyma, known as renal calculi or microlithiasis or nephrolithiasis. Depending upon the size and depending upon the content of the stone, they have been divided into different forms. In India, the most prevalent kind of stones which we see are calcium oxalate stone, uric acid stone, and struvite stone, which are nothing but infective stones. So, first of all, we will speak regarding why these stones are formed. One of the most important cause of formation of stone is dehydration. When you don't take proper amount of fluid at regular intervals, which in turn leads to stasis of salts within the body, which in turn leads to formation of foci of small microlith formations, so it's concretion, which in turn grows further and form big stones. So dehydration is a major source of stone formation. Second, excessive salt intake also leads to increased concentration of salt within the urine formation, as a result of which this concentrated salts will lead to stasis, will lead to small micro nephrolithiasis, which in turn will aggregate and aggravate together to form a bigger stone. Also, the food habits, like the foods which are rich in purines, the foods which are rich in proteins, will definitely lead to more of uric acid formation. And when this uric acid is not been diluted or not been kept in a very proper form within the urine, it will again lead to crystal formation, which in turn leads to stone formation. Lifestyles, lot of stress, also taking lot of beverages like carbonated beverages, taking lot of fast food, or taking food which are rich in salts also leads to more and more of salt concentration within the urine, which in turn leads to crystallization and formation of stone. So this was a brief idea regarding what are the kind of stones and how they are formed. So majorly dehydration, infection, taking a lot of protein rich foods, and also decrease in what we tell the calcium food, increase in more of oxalate food. So in general, dietary habits and lifestyle leads to major stone formation. In urban areas like cities, I think lifestyle and dehydration, taking water at abnormal intervals or very less amount of water, and also the food intake, the food what we eat, are the major factors which leads to stone formation. So what are the symptoms when the stones affects our kidney? So first of all, stones will lead to colicky pain. It's so severe that it is associated with lot of nausea and vomiting. Sometimes this kind of abdominal colicky pain, which is radiating from back to front, can be associated with blood in urine, burning in urination, and fever also. So these are the signs which tells us, yes, you are suffering from stone, and definitely investigations has to be done and proper management has to be taken. So regarding how we investigate a patient with all the symptoms will come later on. Right now, I will just let you know the alarming signs when you need to stop taking medications and rush to a doctor, get admitted and take proper treatment. So first, when the vomitings, when the pain is so severe that whatever you take just spewed it out, it leads to severe dehydration, plus you're having high grade fever more than 101, excessive amount of hematuria. All these three major symptoms, these are the three major symptoms which you should get alarmed and you should seek hospitalization as early as possible. So, now we will speak regarding how you investigate when a patient comes to me in the OP saying that, yeah, sir, I am having this pain from radiating from back to right, some amount of blood in the urine. So, what are the basic tests which we normally order? So, first, a scanning report called ultrasound abdomen with pelvis or ultrasound of kidney, ureter, and bladder is mandatory because it will help in scanning about from where the pain is being generated. We also look for blood reports like complete blood counts, renal function test, urine examination in the form of complete urine examination. These are the basic tests, and also X-ray kidney urinary bladder, X-ray KUB. I think this makes a panel as the first investigation which anyone should undergo if they are suspecting a kidney stone. So now comes the treatment part. So first of all, I'll be talking about the dietary modification or the things which we should take into consideration in order to prevent stone formation. First, take water at regular intervals and also proper amount of water should be taken. For example, I recommend 200 ml of water every 2 hourly during the working hours or during when you are awake. Some people say that I drink around 4 to 5 liters of water, then too, I got kidney stones. So in that case, I go back and ask about the history, how they drink water. So in that case, they say whenever they go for running or jogging for exercise, instead of keeping hydrated themselves during the whole course of the workout, what they do, they will just come in house and gulp at least 1 or 2 liters of water together, which is not correct. You should keep hydrating yourself at regular intervals. Maybe during workouts, every 15 minutes, 20 minutes, at least you should have some amount of like 100, 150 ml of water should be taken. Second, infection. Whenever there is infection, you should take proper care rather than neglecting it. Dietary modification. Decrease lot junk food which are rich in salts, food which are rich in red meat, because all this will lead to increased uric acid, crystallization of uric acid, and in turn leads to stone formation. Calcium intake. There should be a proper calcium intake because which reduces calcium oxalate stone, which is one of the major important type of stones seen in India. There is a myth saying that, sir, if I'm taking calcium, I'm getting stone. No, it is not so. If you take calcium in proper amount, for example, an adult should at least take 2 cups of milk or a banana in a day normally will suffice his calcium requirement. So calcium has to be taken in older age when they lose bone densities because of loss of calcium. In those cases, even if they are taking a calcium tablet, will not lead to calcium oxalate or calcium stone formation, which is a myth. Decrease oxalate rich foods. Oxalate rich food means the food which are rich in oxalate like spinach, tomato, tea, coffee, cocoa, cashew, nuts, all those things. I have never told that stop eating. I told that reduce the amount of oxalate rich food in your diet. So there is a lot of difference between reduce and stop. Last, animal fats like meat, everything should be decreased in those patients who are prone to form uric acid stones. Also, the protein intake in the form of dals, grams, everything, chana dals, even tuver dal, any kind of proteins like paneer, everything should be decreased in those patients who are having uric acid stone formation, recurrent uric acid stone formation. Drugs. There are certain drugs which definitely lead to more and more stone formation, but that can be prevented if you keep yourself hydrated very well. It's very important. So hydration is the key point. Infection has to be treated, and dietary modification, as we discussed, definitely will prevent the stone formation. Treatment point of view, normally a stone are being treated in two ways: medical treatment and surgical treatment. Nowadays it will be a very crude word to say surgery when we speak about stone treatment, because we are much more advanced in surgical treatment that we should normally replace the word surgery with a procedure. Definitely I'll recommend that. So medical treatment is definitely recommended when the stone size is less than 5 mm, when the patient is not having very severe symptoms like fever, vomiting, or hematuria, when the patient is quite comfortable, the pain is bearable. In that case, medical management in form of antibiotics, painkillers, alpha blockers, and diuretics are definitely recommended. As we have discussed the alarming signs, whenever there are alarming signs, the things will change from medical management to surgical management or to some procedures in order to remove the stone out. In modernization part, we normally remove stones in under three major topics like laser treatments, or we go for a keyhole procedure called PCNLs. Laser treatments like RARS, URSLs are right now so much advanced with the equipments that the procedure have become very simple. PCNL, though, is a challenging procedure, but I think it is one of the good inventions which been done in urology in order to treat major big stones like staghorn stones, two white stones, and give a new life to the kidney. Nowadays, people are been recommended during the summer season. We normally recommended those patients who are prone for stone formation to take certain alkalizers to keep the urine alkaline, and certain drugs like which decreases the oxalate absorption, also which decreases the uric acid formation, to be taken during this summer prone part when lot of stone formations has been done. A special care has to be taken in elderly diabetic patients, where sometimes in diabetic patients stone might be big, but there might not be apprehensible pain which has been recognized by the patient. But diabetes itself is a silent killer, and in those patients definitely the stone should be treated as early as possible. So in a nutshell, I want to just wrap up my talk by saying that renal stone is a very common disorder which has been seen in the public. Dietary modification in the form of proper hydration, some dietary modification like taking proper amount of calcium, decreasing salt, definitely will decrease stone formation. And also in today's era, the procedures are so excellent that without any cutting, without any stitch, without any hole, most of the stones can be treated. Okay, so in this summer, please listen to the message. If you want to prevent stones, keep yourself hydrated, have proper amount of water, treat infection on time, and take doctor consultation whenever there are warning signs, as I have discussed earlier in my talk. Thank you. Okay.